Welcome back, everybody. For all the cosmetic changes you can make to your smile, the most noticeable is its brightness. And there are a few ways to achieve a bright smile. And on today's Great Look Monday segment, Dr. Todd Shatkin is back from the Aesthetic Associates Center to talk about this subject. Take your calls at 644-9840 and to introduce his patient, Kimberly Zach, to us, who I betcha has a great smile. And there it is. Hello, Kimberly. How are you?
Hi, very good.
Beautiful. Look, gorgeous smile.
Thank you very
gorgeous
much.
Face.
Thank you.
Dr. Shatkin, you would help her achieve that.
Well, Kim's been a patient for quite a long time, and recently she came in and said, you know, I really would like my teeth to be whiter. And so we did the Zoom whitening, the 1-hour laser whitening procedure, and made a big improvement just a few days ago.
So you just had it done.
Right.
Great. How's it feel? Feel good?
It feels great.
Yeah?
I'm walking around smiling. People are saying, what's different? What's new?
And no sensitivity.
Not at all.
All of that is by the by now, so in case you were worried about that, that's not going to happen.
It was very relaxing.
Really?
It took an hour, and there's a TV screen you can watch. And the funny part, I watched Day in Buffalo.
Well, thank you.
And I just, sat there and watched TV, and I went to work. I felt great.
That's fabulous. You look terrific.
Thank you.
Very, very nice. And as we say, now she did the Zoom 1 hour.
Right.
That's one way to do it.
Yeah, that's the main way we do it now in our office. There is still the home whitening programs where you can use the trays and put the gel in the trays and whiten them that way. But the Zoom, it's called the Zoom Plus. This is the most effective of all the laser whitenings on the market now is the Zoom Plus. That just got upgraded a few months ago. And we're having great results with it.
Now, is that the one that uses the blue light?
Yeah, it's a light that shines on your teeth for an hour, about 45 minutes actually of active treatment. We apply a gel to the teeth. We have to protect the gums and we retract it, but it's become much more comfortable, and the patients seem to have a really nice result after.
That's great. That's amazing. You can literally shine a light on something that chemically changes.
Yeah.
What's on your teeth.
Well, the teeth, if you took a tooth up and you held it up to a light, you'd see through it. It's translucent. And so what happens is the light penetrates through that translucency into the deeper layers of the tooth, and the combination of the light, which goes into the tooth to open up the tubules, allows the gel that we put on the teeth to be penetrated as well.
Now, it doesn't weaken the teeth in any way?
Not at all.
Not at all. And how often might she want to have that done again, if ever?
Well, it typically lasts about 18 months. If you're a big smoker, you drink a lot of red wine or coffee or tea, it's going to last a shorter time, maybe 12 months. But we do give you home products to use in the interim to keep them whiter. And if you maintain your teeth, they should stay pretty white, but you may need to get a touch-up once a year.
It's funny because usually, and I think we've talked about this before, once you get this done, people stop drinking black coffee or tea without milk in it at least, and maybe even stop smoking because they don't want to ruin these beautiful results,
And if you're going to go to the Bijou Grill and have a really good glass of red wine, you're going to need to come in and have your teeth cleaned.
And then go to white wine after that.
Right.
So what have people been saying? They notice a difference, but they don't know quite what it is.
I'm not sure what it is.
Yeah, that's fabulous.
You look refreshed. What's different?
Yeah. Kimberly, we should let everybody know where you work and where you're seeing, because you're a familiar face to a lot of people.
Right. Well, I like to help out with a lot of charity functions. Years back, I used to cheerlead for the Bills, and right now I'm working at Fridays in Williamsville, which I smile all the time.
So this helps a lot, right?
Right.
Well, you're a friendly person anyway, but
Thank you.
I know that you feel more confident when you can smile and you have the smile that you want to present to people.
Right.
Right. That's great.
The one thing I wanted to mention, Linda, is because we're almost at springtime, we're going to do a spring special, so you can save $100 on your teeth whitening. So instead of $500, it'll be $400. Right up, and we'll say up until Easter.
All right.
Okay.
So people should call you now.
Sure.
They should call and make that appointment now. And if you have a question about teeth whitening, 644-9840. Now, if you are going to be doing other work on people, would you save the whitening process for the last step?
Well, usually we do it first, actually.
Oh, really?
Unless they have problems with their teeth where they have sensitivity or pain, then we have to treat that problem first. But if somebody comes in, say, for a cosmetic procedure, maybe they need some crowns in the back of their mouth, we'll whiten the teeth first and make sure that then we can make the crowns to match the whiter teeth.
I see.
Or if we're going to do a combination of some veneers or something like that. So it depends on what the situation is. Sometimes we do it before, sometimes we do it after.
Now, if you're going to have other work on teeth, and this procedure isn't right for you, how else might they become brighter?
Well, that's a good question. You always have great questions here.
Well, I'm thinking of those things.
You're really a pro at this. They should hire you here.
You think?
No. But truthfully, a lot of people are not candidates for whitening, and usually it's if they have what's called tetracycline stained teeth, which is something that an antibiotic many times you take as a child. Your teeth get stained from within. It's not just the outside, but it's intrinsic staining. Those stains don't whiten too well. So a lot of times we have to do veneers or bonding or something, or crowns, depending on what needs to be done. So that may be an option for them. If their teeth are chipped or rotated and misaligned, then we might do a combination of Invisalign with veneers or something like that.
So don't think automatically because you're not a candidate for something like this, you can't have it done.
Right. And some people do have very sensitive teeth. If your teeth are extremely sensitive when you eat cold or hot foods, you may not want to have this done because you can get more sensitivity afterwards for a period of time.
Is there an age that would be, good and older, or do you do this on very young people?
The rule of thumb is that all of the teeth should be erupted and in the mouth. So typically around 15 years of age would be the cutoff. If your teeth are erupted, your permanent teeth are all in your mouth, usually about 15 years of age you can do this. Sometimes we can do 14 or 13, but usually 15 is the right age.
What do you think of all the over-the-counter stuff? I mean, every time you're buying toothpaste now, or even mouthwash, they're saying this will brighten your teeth.
I think for the most part, the majority of over-the-counter products are fine, especially since now the FDA got involved in regulating some of these things about 6 or 7 years ago, and so they had to test the claims to see that they're really efficient. And I think for a home regimen to keep the teeth clean and white and bright, it's fine. If you want to get that really change in appearance, you need to see a dentist to do that. But then to maintain them, I think most of those products are fine.
Good. Okay. We have a phone call for you. Someone with a question. Hello. Hi, caller. You there?
Hello.
Yes. Hello.
Good morning.
Yes, I am.
Go ahead, please.
Hi.
Hi.
I'm Carol from Hamburg.
Go ahead, Carol. Just talk into the phone.
Hi. And
okay, we must have that delay on.
I have a cap. It's an older frontal cap.
Okay.
And I've been using the white strip where my other teeth are, really getting white. But of course the cap doesn't. It's yellow. Would you do anything with the cap?
The cap would have to be replaced after the whitening is completed. Porcelain products will not change in color from whitening. Bonding will not change in color. It'll always be either the color it was when you put it in or darker because it may have developed some stain over the years, but you can't whiten those situations with a whitening procedure. So in that case, you'd come in, we'd talk about it, and we normally would do the whitening and then immediately replace the cap afterwards.
There you go. And it sounds like that's the way she would want to go because she's interested in having white teeth, and to have that one that's always going to stick out. And as she says, as the other ones are getting whiter, that one is more prominent because it's not.
And a lot of times what happens is the other way around is you'll have a cap done maybe when you're 20 and your teeth are fairly white, and then you become 30 and the rest of your teeth have stained, but that one tooth is still white. You've seen people that there's a tooth that stands out. And so a lot of times you need to whiten up the other teeth and then maybe replace that one, or maybe you can get the other teeth to match by whitening them up.
All right, another phone call. Hello, you're on with Dr. Shatkin. Hello, caller.
Hello.
Yes, go ahead, please.
My name is Steven Zdrasky. I'm a former patient of Dr. Shatkin.
Yes.
Hi there, Steve.
He put my implants in. It'll be a year in May. I have to see him back in May. But I'm grateful and wonderful and doing fine.
Oh, isn't that nice to hear?
It's nice to hear from you. I look forward to seeing you again. I know exactly who you are, Steve.
Yeah, I'll be seeing you in May. May 24th.
Okay.
It's a date.
Thanks for calling. I'll confirm your appointment when I get back to the office.
Okay, doctor. Thank you.
All right.
Well,
buddy.
that's like the best call you can get.
Sure.
Especially on television.
I love to hear from happy patients.